This is Michael. This is my patient Derek. So Derek, I'm going to be doing some palpation for you today to identify some landmarks to help me orient myself with you. So that's going to require me to be touching your shoulders, your elbow, hips, your spine, and your knees. Is that okay with you?
Yeah.
Okay,
Good.
perfect. So first off, we're going to start off. Is it okay if I move your shirt a little bit? Okay. And I'm just going to move your shorts down a tad bit. First is the anterior superior iliac spine, coming in anteriorly with the palms. So this is significant because it's the origin site of the sartorius muscle, as well as it helps us orient ourselves moving laterally to find the tensor fascia lata. If we move up just a little bit with the ribs, we can find the liver. Can I have you breathe in and out for me? Let me feel that firm end feel of the ribs on the liver there. If it's soft, that means there's some pathology there and something's wrong. This also can help us orient ourselves with finding ribs 8 through 10, since those ribs don't connect directly to the sternum. And now I'm going to have you bend your right leg for me. And can I have you roll your pant leg down as far as you can?
That far enough?
That works. That's perfect. Okay, so again, I'm going to find the anterior superior iliac spine, and I'm actually going to find the pubic symphysis as well to find the inguinal ligament. And then from the ASIS to the knee, we have the sartorius, and from the knee in towards the midline is the adductor longus. Going to have you push against my hand. Perfect. Relax. So in that triangle, in that space, once we identify the adductor longus, is the femoral artery. So in there we can find your femoral pulse as well. Perfect. Now you readjust your shorts for me. And now lay on your side facing that way.
Yes, sir.
Yes, sir. So here most superiorly is the greater trochanter of the humerus, which is significant because it's the humerus, the femur. Greater trochanter of the femur, which is the insertion site for the hip abductors as well as your hip intrinsic external rotators. And it's significant because of the bursa there as well. Can I have you now lay on your stomach? Roll your shirt up again. So here, posteriorly, we can find the PSIS, which is in line with the S2 vertebrae, and is significant because this is part of the origin site of the latissimus dorsi as well as the gluteus maximus. And moving inferiorly into the sacrum, we feel the sacrum dive medially, and that is where we find the inferior lateral angle of the sacrum. And that's also significant because we have to go through the gluteus maximus to find it, as well as it is a site of attachment for ligaments. And then moving, finding the gluteal folds of the gluteus maximus. Moving superiorly, we can find the sit bones, the ischial tuberosities. And this is significant because those are the origin sites of the hamstrings, as well as for other ligaments, the sacrotuberous ligament and the quadratus femoris muscle inserts into there as well. Moving back to here, once we find the PSIS, find S2, we can move up to S1 and then L5. L5 is significant because it's the most prominent lumbar spinous process, and it also helps us orient ourselves with common sites of lumbar herniations. And even moving further up, we can find the 12th rib right here. And that is significant because we can follow that up to the 12th, the T12 vertebrae, as well as it is an attachment site for the quadratus lumborum muscle. All right, now Derek is in his seated position, and we're going to find some structures on his lower limb. So here would be the knee joint line. This is significant because deep to my thumbs are the menisci, and if I move laterally on this side here, if I'm careful, I can find the lateral collateral ligament of the knee, and conversely on the medial side, as I move along the joint line, I can also find the medial collateral ligament. In the same region, we have the fibular head right here of the fibula, and this is significant because the common fibular nerve runs right by the right on top of the fibular head, and you can palpate that. As well as this is an insertion site for your biceps femoris hamstring muscles. And further down here, we run along the tibia to find where the tibia ends, to then go right below it to the talus. And if I could have you dorsiflex your foot for me, just kind of move your foot and then go into plantar flexion, it'll expose the talus a little bit more. So significance of the talus is that the talar head is a common site for osteoarthritis, as well as the talar neck is a common site for fractures. If we move laterally, here is the anterior talofibular ligament, which runs from the talus up to the fibula, to that lateral malleolus. And this ligament right here is the most commonly ruptured ligament in ankle sprains. And then next we have, just going posteriorly here, we have the fifth metatarsal that's running this way, and at the posterior end of it we have the fifth metatarsal's tuberosity. And this is significant because this is a common site for avulsion fractures, as well as this is an insertion site of your fibularis brevis muscle that comes down through here. And now I'll move to this other foot. Here we can find just relax your foot for me. So coming off of the medial malleolus, we can find this very prominent talar bone here on the medial side, and that's the navicular bone, the navicular tuberosity. And this is significant because the spring ligament connects the navicular to the calcaneus, as well as this helps us orient ourselves to find the medial cuneiform and posteriorly back to the calcaneus. So next, we're going to be doing some structures of the shoulder. So we're going to move up here to his shoulder. Okay.
That's fine.
Yeah, that's fine.
Go ahead.
So first we have the AC joint, the acromioclavicular joint. So we're going to find the clavicle and run up until we run into the acromion. And that joint space, or that joint, is significant because of the common shoulder dislocations that happen here that could rupture the acromioclavicular ligament as well. Finding this joint, conversely, can also help us find the rest of the scapula once we find the acromion. Then from here we have the subacromion space, where from the acromion we just dive off and find the humerus, and that space right in there is where we have the subacromial bursa, and it's a common site for impingement of the supraspinatus muscle. And from here, I'll actually go anteriorly, we have the greater tubercle of the humerus, right here, the most prominent structure anteriorly on the humerus. This is significant because this is a common insertion site for the rotator cuff muscles, as well as this will help us to find the biceps tendon, which runs in the intertubercular groove. And moving again anteriorly, just inferior to the clavicle, we can find the coracoid process of the scapula. And this is significant because it's an insertion site and an origin, an insertion site of the pectoralis minor and an origin of the coracobrachialis muscle. Perfect. So now, moving down to the elbow here, on the lateral side, following the humerus down, we have the lateral humeral epicondyle of the humerus, and this is a common site of what's called tennis elbow, as well as the common origin of all of the wrist extensors here. And then moving medially, we have the medial, thank you, Derek. We have the medial epicondyle of the humerus, which is the common origin site for the wrist flexor muscles that run through here, as well as muscle pathology there as well, similar to the tennis elbow on the lateral side. And then here, going back to the the lateral side, easier from the posterior, we follow the humerus down and find that joint space between the humerus and the radius right here to find the radial head. So the radial head is significant because the annular ligament runs around it and keeps the radius there, and it's also a common site of fracture in that radiohumeral joint. So now, let's see, if you could turn that way, and I'm gonna have you spin around, and I'm gonna do some structures on the back.
Is this okay?
That's fine. So from here, we can find the scapular spine. So running from the shoulder, it's a long groove of the scapula, long ridge, and this is significant because if we find both of them and draw a line between them, that's very commonly the site of the T3 vertebrae, and as well as an insertion site for your trapezius muscles. And as we run inferiorly, we can find the inferior angle of the scapula right here, and this is in line with T7 vertebrae, and this is significant pathologically because of scapular winging in the case of serratus anterior weakness or long thoracic nerve damage. Next we're going to be going up to the head. So for the C2 spinous process, we're going to find the superior external occipital protuberance and run posteriorly. Sorry, just going to try to be gentle. And we find the first prominent spinous process right there is the C2 spinous process. And this is significant because it is the first prominent one. We don't feel the C1 spinous process there. And as well as it is an insertion site for a couple of the suboccipital muscles that make up the suboccipital triangle, the obliquus capitis inferior and the rectus capitis posterior major. And in that same spot, we can find the articular pillars of the cervical spine, which then help us identify laterally the transverse processes of the cervical spine. And the articular pillars are also significant because that's where the vertebrae are connected, where they lay on top of each other. And then from here, for the junction between the C6 and C7, we're going to find posteriorly the most prominent spinous process, which should be the C7, but I'll move just superiorly and can I have you flex and extend your neck, Derek? Perfect. And then flex it. So while he was extending, go ahead and relax, go back to neutral. While he was extending, the C6 spinous process disappeared, but the C7 spinous process stayed prominent. And this is a significant site pathologically because between those two vertebrae is a common herniation location. And then the next would be the first rib. To find the first rib, we just come down from here next to the trapezius muscles, and it's the first firm end feel that you have coming down. And this is significant right here because it could help us find the T1 vertebrae just below C7, as well as it is an insertion site for your anterior and your middle scaling muscles. Okay, so now we're going to be looking at some hand bones. So if I can have you extend your thumb just like that, perfect. We can find that space right in here called the anatomical snuff box. Deep to this is your scaphoid bone. And this is significant because it helps us orient ourselves to find your extensor pollicis longus and brevis muscles, as well as your extensor pollicis longus and brevis, as well as your abductor pollicis muscle there as well. It's significant as well because it's a common site of wrist fracture due to the lack of blood supply. It doesn't heal very well. And now from this other side, as we bring the wrist out this way, we find this most prominent wrist bone, the triquetral bone, which is helping us locate closer to the elbow the ulnar styloid process right here. And between those 2 points is the ulnar collateral ligament as another reason for significance.